Welcome back and many thanks for staying with us right here on the number one breakfast show in the country, Morning at NTV. It's a beautiful Wednesday, the 23rd of June. That also happens to be the United Nations Day for the United Nations Public Service Day. It was designated in 2003 by the United Nations General Assembly to celebrate the value and the virtue of public service to members of the community. Right here in Uganda, what is the state of public service and what are some of those factors that have made it impossible for our legislators, members of government and other stakeholders in actually ensuring that they offer great public service to our people. So I do have Brian Kiira. He is a programs officer working with the Initiative for Social and Economic Rights. A very good morning, Brian. You're coming to us live from Nigeria. How are you doing this beautiful morning?
Thank you very much, Romeo, and I'm doing just fine. I hope you all are, and greetings to all our viewers.
All right, we are dealing with a global pandemic in Uganda here. It's rearing its very ugly head. I mean, we are talking about 73,401 cases of COVID-19. 714 people have actually succumbed, Brian. And in line with the president's call to the cabinet and the prime minister's call, that is Robina's Nabanja's call to go for service delivery, I would like to know, there's also a call for government to actually check the rising cost of healthcare in this country. Brian Kiira, where do you think we went wrong?
Thank you very much again, Romeo. And before I get to that, I think as we commemorate this day, as you rightly stated, it is important that to start off with in solidarity, would also at least like to appreciate public servants that have been, at the front line during this pandemic. I think it is very important that we do that because they've put their lives on the front line, and it is no mean duty. Now, getting to what you just said on, how did we exactly get here?
Yes,
I would like to say that one of the most important things that I think as a state we left by the wayside is the importance of adequately investing in our public social services system. And indeed, I'll use the example of the health sector, as you have said, but we all know that our public social services, stretch all the way out to things like education, water, electricity. But let me just try to give an example using the health system. You'll notice, and this has been chronic, that there's been an underfinancing of the health sector, for example, years on end. And the challenge is that even in the midst of the pandemic, where you would have thought that the government would have, tightened its pants and pulled up its game, we still have the very challenges. At the very onset, when we had the pandemic breakout, you do remember quite well that at that particular time, we were in the process of coming up with our, nation's budget. But then even still, with the advantage that we had, that we had the opportunity to pull a number of resources around to be able to strengthen the ailing public healthcare system. That did not happen. Still, meager resources were allocated to the sector, and this has gone on for over the last 5 years. And I think when the pandemic found us, so there was no option. We had to crumble in a way. And even issues such as oxygen crisis that we're hearing right about now, these are not issues that have just come out of the blue. We do have, issues that have been going on around the availability of oxygen, even in public health, the public health, facilities. And so now with COVID-19, when we have apparently a strain on our finances, it is now that government is, coming out to cry, and Ugandans do not know that we've had this all along entrenched. And further still, some of the challenges that we've had is that the government, in not adequately financing the public health sector, has instead created a conducive environment for private actors to be able to operate as they could. There hasn't been regulation. The regulation is very, very, very dismal. And I think this is rather appalling. And we all know, and as evidence has shown, that the moment you leave such critical public goods to market forces, then what we are bound to have is exclusion, mass exclusions at that. You'll find that because of the motivations of private entity, which I dare mention be a profit, many times accessibility becomes a challenge. Case in point, we've all seen how access to COVID treatment or even mere testing has been during the pandemic. You can bear with me right now if you try to go for a COVID-19 test, you cannot be able to access the same below 200,000 Ugandan shillings. And not very many Ugandans at this point are able to access that. It is now a period where each and every Ugandan is looking at how to spend their money. Would I rather go hungry, or do I need to, spend on healthcare? And the challenge therein is that most times we shall find it very hard. And of course, in instances where we have no option, you'll find that people are spending an arm and a leg to be able to access these services. We've had stories, and these have also been reported in the media, that to be able to access treatment for COVID-19, several private facilities require that you deposit a fee of 5 million Ugandan shillings. Now, I dare say that even for those that are privileged at this point to, let's say, be earning, some form of salary, this money is still very, very high. It is, prohibitive. How then do you expect most Ugandans to be able to access public services? And so our challenge has mainly been in the government's lack of stewardship. I think the government has really played a background role. And yet, as we all know, according to its international obligations, the government is supposed to be the primary duty bearer of ensuring that all Ugandans or its citizens, access these services and these human rights, for example, health and education, are realized.
Well, do you think
the stage has for long, Romeo, sorry?
Go ahead.
Yes, the stage has for long been set, and the results of that can even be seen on the ground. If we are to check, you'll see that, for example, in Uganda, the private health sector covers the largest part. About 55% of health facilities in Uganda are private. And what this means is that the numbers themselves are just, worrying in itself, the coverage. But then also this, on the other hand, means that public health facilities are fewer, and it doesn't help that they're being underfunded. So you'll find, and then the fact that public health facilities, without a doubt, are the first point of call for the most vulnerable. Romeo, I do not know, maybe you being an urban dweller, or,
yes, Brian.
as we like to say, the working corporate, we might not be in touch with some of these realities certain times, but you'll notice that whenever a person in, the more rural areas, areas that are geographically disadvantaged, whenever they have a health crisis, their first point of seeking any sort of remedy is always a public health facility.
Indeed.
And so if they get to that facility and there are no drugs, there are no health workers, there is no electricity, you can imagine these are also Ugandans that have, however, been forgotten.
Indeed, Brian Kiira, I can see where you're coming from with that argument, because even the people in Katanga, they're near Mulago National Referral Hospital, but they even contend that they can't go and access health services within Mulago because it is too expensive.
Yes, thank you very much. And even for the, as you rightly stated, some of the urban slums, this is still the case. And then, and it's just been horrifying to even think that the challenge has further, permeated into, affecting even the frontline workers, the public servants that I talked about in the initial phases. Right now, when you go to public health facilities, one would think that it is obvious that since these are the people that are putting their lives at stake, that then their welfare will be, tended to first. But I'll have you know that even in these public health facilities, health workers do not have protective equipment. You find that even for those I've spoken to, a number of them, or for those that are able to have a mask, some will tell you, we are not given face masks. Something as small as that. They will tell you, I have to buy my own face mask every day. And then you find these health workers putting on medical masks, a medical mask that you're supposed to use for one day at most, and they're having to recycle them. Now, for me, I think that situation is rather appalling. And we've also been seeing that the pandemic has indeed been claiming many lives of these frontline workers. So our challenge has been in not prioritizing public health services or any public services for that matter. The same goes for education, because even then for education, the reluctance of government to put its foot forward and ensure that these are also adequately financed has been a challenge. It's at this point that you've seen private, education institutions cropping up, and the fees are crazy. Fees are crazy, and at a point where not many, can access. We've been seeing instances of, schools that have, for example, gone ahead to say, we are no longer going to be having a day section of this school. And that only means that then a learner will have to be compelled to adhere to compulsory boarding requirements. And this, of course, comes with further costs, most of which people do not have. Even in the phase when we're talking about issues of reading materials being disseminated to different areas in the country, you'd find that then even when these materials would reach the communities, many a time people were told to have to, photocopy these materials. And that money was just not there. So at the end of the day, Romeo, as I've tried to belabor this point, it is very, very important that we see the government stepping up in ensuring that the resource envelope
Indeed, Brian Kiira, he is the Programs Officer at the Initiative for Social and Economic Rights. And of course, you mentioned that many of these problems that we are grappling with right now have largely been existent or prevalent for the last 5 years. And if this pandemic has not prompted the government to step up and allocate more money to these sectors, education, social development and health, so what will actually prompt them if not even the pandemic is making them wake up? We are talking about 1.5 trillion shillings being allocated to health, 560 billion is going to procure vaccines, 526 billion is going to education. We also do know that only 358 is going to the private sector for the resuscitation of businesses. Do you think government will ever learn, even though the pandemic is here?
Thank you, Romeo. And from the look of things, I like to say, and again, reiterating what I just said before, of the fact that all this came in at a time when, we had all these, resource mobilization, processes going on, right from the domestic ones of, our national budget, but then also now we see that many calls were made at an international level to try and harmonize resources. The accountability for those resources is yet another issue. But we can see that government seems not to be able to notice the challenge we have at hand. We remain, of course, hopeful that with the numerous calls, and we're also glad that today presents us with an opportunity to be able to speak to some of these things. We hope that the government will be able to catch on the gravity of the situation. We hope that by the time they come to this realization, we shall not have lost over 1 million Ugandans to the pandemic for one reason or the other. One thing that they forget is that investing in such service delivery in turn strengthens the economy. If one likes to look at it from the economic perspective, once you have a community or a society whose citizens are well taken care of, then it is just circular. In the end of the day, the economy will be strengthened, but also, the welfare of the citizens, the people that are bearing the brunt of the taxes that you're imposing, will also be, taken care of. And for all the times that we see that service delivery is going on well, then we also only know that when we hear, the concept of taxation, we are ready and willing to jump on to be able to pay whatever just taxes are imposed, because then we can see where this is going. And Romeo, just to say, I don't know if I still have some time.
Yes, we do have some 4 minutes.
Oh, thank you very much. And so our challenges, as I said, have stemmed from inadequate government stewardship. And these have largely been, a cocktail of, neoliberalism, illicit financing flows and corporate capture.
But Brian, Kiira, away from the challenges, we've also seen marked improvement when it comes to public service in the areas of tax management, in the areas of driver's license provision, aided by the use of ICT. So how do we best paint these successes to other sectors, if you will?
Thank you very much, Romeo. Be that as it may, for some of, and of course not to entirely downplay everything that has been achieved by government, but at the end of the day, we're just trying to say that it hasn't been enough. It hasn't been enough. You will notice, as I also said, that the issue of corporate capture, for example, still it festers. We are creating, for example, an environment that is so conducive for investors, but forgetting that we need to equally, impose upon, such investors fair tax, cuts. Uganda in East Africa is ranked as one of the most lenient governments in as far as, taxes are concerned for corporate actors, be it in the extractives industry. We are all too generous to give out tax waivers to these people, regardless of the money that they're making. But at the end of the day, you'll find that some of these avenues have not been explored to be able to expand the tax base. It doesn't make sense if you're going every single time to say that, oh, we have an investor, let's give them a cut. It is okay that, sometimes these are used to invest, to attract investors, but then at the same time, if you're giving them that leniency and then you further impose the tax burden on the citizens, it doesn't make sense if it keeps going on and on. And so I think we need to explore more avenues. And in so doing, we are just trying to appeal to the government to be able to reclaim public services. That is what we're saying. Be able to bring public services closer to the people. We need the government to take deliberate and targeted steps towards delivery of, these quality public services, and free at the point of use for the people. And also one of the other things that we need to be able to harmonize the resources that we have is to also strengthen and clamp down on corruption, on nepotism, on favoritism. Let's be able to have every single penny that we can have. Illicit financial flows, let us be able to monitor all this and make sure that we're not losing money unnecessarily. But then also to be able to strengthen social protection measures, even for public servants. We've seen that now is the time where everyone is looking to the government for some sort of social protection. Having, being able to invest in it will also go a long way in not only, cushioning us against the impacts of this pandemic, but even for any other unforeseen pandemics, in quotes, that we may encounter. So we're just urging government to rethink how it engages, the private sector. In health, for example, the issue of, public-private partnerships, rethink them. It has been clear that they do not, evidence is there that they do not exactly foster equity in access to healthcare. So rethink them. We need adequate investment in the public health service delivery, sector, but also regulation of, the private actors in health, in education. It is very important. Do not let them act to their own, whims. We need someone looking over them. And lastly, to also promote meaningful engagement and participation of the citizenry in whatever policies, the government enacts. It is important because at the end of the day, it also points to accountability. And if, we have accountability, it only means that we are able to still harness the resources that we have.
Brian Kiira, the Programs
hopefully
Officer at the Initiative for Social and Economic Rights. Thank you very much for having made the time to speak to us. He's coming to us live from Nigeria. Very good morning, sir. Well, we were talking about the United Nations Day for Public Service. In that regard, it was designated. That was on 2003, actually to celebrate the virtue and the value of public service to the community in that regard. Yes, we were expanding more on that. We were expanding more on the issue to do with service delivery, the fact that health has gotten meager funding. Only 1.5 trillion was allocated to the Ministry of Health, and 560 billion will be used to procure vaccines. Education got only 526 billion, and